While South Africa has the highest number of people living with HIV in the world, it has already made enormous progress in expanding the number of people accessing treatment for HIV, resulting in a 66% decrease in AIDS-related deaths since 2010. New HIV infections have also fallen by 58%. When people are taking effective HIV medication, they no longer transmit the virus, meaning that treatment rollout alongside other HIV combination prevention measures contributes to lower rates of infection and future cost savings. Domestic resources account for around 74% of South Africa's HIV response, which demonstrates the political will and commitment of the country's leadership to end the AIDS pandemic. However, many services still rely on funding from the U.S. government, which accounts for around 17% of the country's financing for the AIDS response. The sudden 90-day pause to U.S. foreign assistance is putting some services at risk, especially HIV prevention services for young women and adolescent girls and other marginalized communities. More than 800 young women and adolescent girls aged 15 to 24 become infected with HIV every week in South Africa. UNAIDS is working closely with the South African government and other partners to mitigate the impact and ensure the continuity of HIV services. UNAIDS, the joint United Nations program on HIV/AIDS, UNAIDS, leads and inspires the world to achieve its shared vision of zero new HIV infections, zero discrimination, and zero AIDS-related deaths. UNAIDS unites the efforts of 11 UN organizations: UNHCR, UNICEF, WFP, UNDP, UNFPA, UNODC, UN Women, ILO, UNESCO, WHO, and the World Bank, and works closely with global and national partners towards ending the AIDS epidemic by 2030 as part of the Sustainable Development Goals. Learn more at UNAIDS.org. South Africa's new plan aims to treat 1.1 million with HIV. UNAIDS welcomes South Africa's plan to put an additional 1.1 million people living with HIV on life-saving treatment by the end of 2025 as a significant step towards ending AIDS as a public health threat by 2030. At the launch of the Close the Gap campaign in Soweto, hosted by South Africa's Minister of Health, Motsoaledi, UNAIDS commended the plan as inspiring. This plan protects the human rights of people living with HIV, offering them hope and an opportunity to live healthy and fulfilling lives by getting them onto life-saving medication, said UNAIDS Regional Director for East and Southern Africa, Ngethuku Shongwe. As South Africa embarks on this inspiring journey, be assured that UNAIDS will continue its strong partnership with the government of South Africa to ensure that everyone living with and affected by HIV is protected through proven scientific and evidence-based interventions. In South Africa, there were 7.7 million people living with HIV in 2023, with 5.9 million people already accessing life-saving antiretroviral treatment, which enables them to live healthy and productive lives. Without treatment, people living with HIV are at risk of contracting opportunistic life-threatening infections because of their weakened immune system. At the launch, Gordon Dadiza, a young man living with HIV, urged other men to test for HIV and to start treatment if necessary. "I am grateful for treatment because it has kept me alive and healthy since I was diagnosed with HIV." Mr. Dadiza has also survived tuberculosis,